here with another question that was sent to us by one of our social media platforms. This gentleman here asks how many grafts it would take to fill in his temples. I don't know if the camera can catch really well. The pictures are kind of fuzzy anyway, but there's some temporal recession here on both sides. Seems to be a young patient. Doesn't say his age in the description of the picture of the question. So his question basically is, he was on finasteride, was having good response, added oral minoxidil to it, had another very good response to it. And then he was off of the medications for about a month and had a lot of regression of the results that he received from the treatment. So basically regressed a little bit. And now he's asking how many grafts it will take to fill the temples. So let's take this into two parts, right? So medical therapy for hair loss, it's like any other thing. It's like losing weight, is like keeping your weight down, is like brushing your teeth. You got to do it consistently. If you don't, then the hair will continue to be lost over time, little by little. So it's important to follow the consistency of the treatment. Regarding a transplant, he seems to be a good candidate, but again, I haven't seen him in person. I don't know his age. I don't know his donor zone here. Looks okay, but if he came to me for a consultation, we will probably talk about the need to be consistent with the therapy to prevent further loss. And also in these two bitemporal recessions here on the right hairline, it can be done. I mean, it wouldn't be a big procedure. What I would do, I would recommend based on the pictures here, would be a few hundred grafts, maybe 800, 1,000 grafts or so to fill in that hairline the corners. But again, this is just spitballing here, not having seen the patient. So important takeaway points: stay consistent with your medical therapy. That'll minimize the area of transplants that you need now and for the future. I'll see you next time.